Good evening, everyone. My name is Simran Chaudhary, and I welcome you all to HeartWise Talks brought to you by Voice of Healthcare. In honor of World Heart Day 2024, we present our special series Heart Smart 2024 Act Now for a Healthier Tomorrow. This series is dedicated to empowering you with the vital knowledge about heart health. Our theme, Use Heart for Action, reflects our commitment to promoting heart disease prevention, encouraging regular health checkups, and advocating for cardiovascular health priorities. And for today's episode, to raise awareness, we have with us Dr. P.C. Mondal, a distinguished consultant cardiologist at Apollo Hospitals, Kolkata. With over 3 decades of experience in the field, Dr. Mondal specializes in interventional cardiology and has made a significant contribution to advancing cardiac care. Welcome to our show, Dr. Mondal.
Good evening. Good evening. Uh, Thank you all for hearing us. We'll discuss about this heart health, and especially emphasis will be given on the theme of this year of World Heart Day.
Thank you so much, Dr. Mandal, for coming to our platform and sharing your insights and experience with our audience and to raise awareness about the heart health. So we'll be discussing about precautions immediately after pacemaker surgeries, athletes and their heart disease, dietary habits, along with the heart disease preventions. So, starting with, sir, I would like to know what are the most important precautions patients should take immediately undergoing pacemaker surgery, because heart is a very important part or organ of our body, and if it is getting operated surgery or anything is getting done, it becomes very sensitive and crucial time. So, what important precautions should a patient take after the pacemaker surgery?
Just after pacemaker implantation, we actually give education to our patients that you are two now. One is your pacemaker, second, and you yourself.
Right.
That means the pacemaker site to be taken care of for the first few weeks very diligently. Otherwise, it can create a problem. First of thing is after implantation, we take precaution regarding wound healing so that most of the time we implant pacemaker on the left upper side of the chest and is nearer to the shoulder joint. That's why we restrict movement of this area. That means left upper arm to be moved less, and we avoid injury to that area, and that area to be kept dry for at least 7 to 10 days. And during that period, we usually keep some dressings. During that period, we take along with these precautions, we take some other medication to for wound healing. And after that, for first few 4 to 6 weeks, we also restrict some amount of movement of this area and avoid local injury. That is the major precaution for this wound. Now, regarding the disease, there should be some precaution for this patient and some warning sign to be uh, communicated to these patients. And most of the time, we give education regarding their any pulmonary symptom that can lead to that pacemaker is non-functioning or there is some problem with the pacemaker. That to be learned. If there is a reeling of head or breathlessness or any blackout, that to be taken care of immediately. These are warning signs. And another thing that they should continue their other comorbid medications. That means if he is diabetic medication to be continued. If he hypertensive medication to be continued. Don't think that after pacemaker implantation nothing is required. Sometimes this can happen. That is rare, but that education to be given to this patient. That means now the patient is two. One is pacemaker site to be taken care of diligently for the first 7 days. After that, there will be some amount of restriction for first 4 to 6 weeks, and his other medications to be continued as before, and also there will be some modification of lifestyle and diet that we will discuss afterwards when there is we will discuss about the prevention of heart disease. This is more or less in nutshell about the another problem that to be discussed with the patient that's very rare now because of some pacemaker module has changed and it is updated now. It is well advanced. There may be some diaphragmatic twitching. That means there may be some hiccup kind of thing that can
Hmm.
happen. It's very, very rare now. I think I have not seen in the last 5 years, because most of the pacemaker leads are now bipolar. Previously it was unipolar. That can create some diaphragmatic irritation. That can give rise some hiccup. That is very rare now, but we can warn them that if there is any kind of symptom, that to be communicated to us immediately. I think
Thank
this
you
is
so. Yes, sir.
all about.
You were saying something, sir.
mm, No.
Oh, okay. I thought there was some internet issue, but that's okay. Thank you so much, Dr. Mondal, for explaining my question so in so elaborative way and in a layman language, so that now people have that awareness, and you explained in a very simple way that now it's you two. One is you, and other is your pacemaker. So yes, you have to take care of yourself, but another thing which has added in your body is your pacemaker. So you should be very precautious about that also, and how thank you for explaining that as well. So moving on to athletes and their heart disease, we know how fit are our athletes, right? Starting from the discipline when they wake up, doing the physical exercises, starting with and have the kind of diet they take, the time of sleep, and everything is so planned, and they follow their routine because it ultimately impacts their performance when they play. And we know this they have to keep themselves fit in every aspect. But how common is heart disease among athletes? And what are some of the specific risk factors which specifically athletes have as compared to normal other people?
Actually, incidence of heart disease is very much less among athletes, because those who are very fit, they come into athletics. That means already natural selection is there. Those who are weak, they will not participate. That's the natural thing. But sometimes we miss something and they miss something. What
Hmm.
we miss, that means, if from medical side, suppose a competitive athletes, there should be a medical checkup. That means that medical checkup should screen something that can put them at risk. We have to exclude some of the conditions which can create problem in them, particularly if there is any undiagnosed congenital heart disease. Suppose a young boy of 16 is coming to us for screening, he will join in, suppose, national hockey team. Then our duty will be to exclude something, particularly if there is any inherited cardiac disease that has been remain undiagnosed till that age. There may be some heart holes or valve disease. Particularly problematic things are hypertrophic cardiomyopathy that can create sudden death during competitive sports. And another thing is arrhythmogenic right ventricular dysplasia, another condition, genetic conditions. These are to be excluded very diligently. And history to be taken whether there was any kind of blackout, any symptom related to exertion is there or not. That can be palpitation, that can be breathlessness, anything. That means screening, medical screening should be very diligent, particularly their history and physical examination, along with some, if required, investigations will be done. That means from our doctor side, we should do a good screening. Second thing, from patient side also, there are some duties. They should not hide any childhood conditions that has gone in their life. Maybe a viral fever has gone, that has created problem, or any joint pain, or any fleeting arthritis, any rheumatic fever kind of history is there, but they are hiding it. They should not do it. That means from their part, they should give a good history of their childhood, and screening should be proper to exclude any bad disease that can create problem in future. Then we have to decide who requires some special investigation or not. And this athlete's heart is a separate entity altogether that develops over time. That means during joining of athletics or during joining of sports, it will not be there. But with time, because of regular exercise, heart muscle get thickened. That means like your hypertrophied heart. Hypertrophy means it's thickened heart. Heart walls are thickened. That can create problem. That requires some deconditioning also. And if that is disproportionate, then we have to think of that whether this fellow is having some disease or not. And that requires some investigation with ECG, echocardiography, and some special test, modern special test like a CT angiography or cardiac MRI, that to be done. But that is not required in most of the patients. When it is very selective. Unless there is something else on routine test, we should not do it.
Thank you so much, sir, for explaining my question on this, because normally there's always this thing around that, the kind of exercise or physical fitness they are into. Sometimes the thing is they may overdo it, and that may cause any kind of heart disease to them, or heart failure, heart attack. So I think that the fear is always there, the risk is always there. But thank you for explaining that.
Now,
Moving
another
on.
thing,
Yeah.
another education to be given to them that you are also a part of common people. You may be more fit, but don't think
Yes.
that no disease can happen on you. That means, suppose the athlete is having a recent fever or a diarrhea, or because of he is feeling exhausted, he should not do heavy exercise in that period. Another
Yes.
thing, after coming back from a leave, suppose there is a he has on leave for few weeks, then he is come back and joining again in the sports. That requires also some adaptation. Adaptation. That means on the very first day after rejoining, he should not do heavy exercise. It will take about 5 to 7 days again to get adapt. That period to be given to all athletes. Otherwise, there may be some problem. That means hiding any minor disease also, that will be problematic. Another thing, adaptation, readaptation to this sports activity to be allowed. Otherwise, it may create problem. And regarding dietary habits, smoking, alcohol, prohibition, all to be implemented on them also. They should not think that I am too much fit, nothing can happen to me. I can take alcohol in a heavy way, or we can smoke and do our activity. That is not there. And diet to be restricted also.
Thank you, sir. A follow-up question on that: does family history also plays a role in this question, the to athletes and their heart health?
Yes. Particularly if there is any congenital heart disease or
Hmm.
particularly aortic stenosis, hypertrophic cardiomyopathy, what I have told you before also, arrhythmogenic right ventricular dysplasia, or any kind of arrhythmogenic heart disease. That means cardiac beat is irregular. That kind of thing to be, suppose there may be a WPW syndrome from childhood, that can create supraventricular tachycardia. There may be some hypertrophic cardiomyopathy that can create ventricular tachycardia. These subsets of patient to be screened out. They should be screened diligently. They should be treated in a proper way. Then, if when found to be fit, they can join athletics or sports. Otherwise, they should not be allowed. That means family history and childhood history is very much important. Very much important.
Thank you so much, sir. Moving on to my next question, which we also included in a previous question, that is dietary habits and heart disease. So we know how important and impactful it is, that the dietary habits on our heart disease, heart health. So are there any particular foods or nutrients that have shown a significant impact on heart health of common people?
Yes, particularly for Indians, the major enemy in our country is the trans fat. That means we should avoid any kind of oil fried foods. Deep fried foods will create problem because this contains trans fat. All kind of fat that we are consuming with deep frying is rich in trans fat, and these trans fat are very atherogenic. They can create arterial blockage. Second in order, our carbohydrate intake is also very high. That's why our lipid, when a blood lipid level, that means cholesterol, triglyceride, bad cholesterol, good cholesterol, there is a peculiar findings we see, that is triglyceride is high, good cholesterol is low, bad cholesterol is high. This has also got relation with carbohydrate intake. So carbohydrate intake should be limited, and that to be limited according to our activity level. Those who are doing sedentary jobs, their restriction will be too much. Those who are in sports, they can be allowed a moderate amount, but not heavy. Third in order, we should implement more of fresh vegetables and leafy vegetables and fruits. These are very important. They are a good supplier of antioxidants, and some of the agents that has been given particular attention regarding these antioxidants. That means all the natural colored foods. Suppose we are taking a tomato or a bean, where from this colors came. There is a natural color. These colors are mostly phytochemicals. These phytochemicals has got a strong antioxidant activity and anti-aging activity. They can keep our heart also healthy, our nerves also healthy, and our arterial walls remain soft. They are not getting stiffened. So these antioxidants, that means phytochemicals, are very much important. And another thing, this besides these phytochemicals and these antioxidants, there are some particular agents. Suppose we are taking more nuts,
Yes.
that can keep a good fat, source of good fat. That means our carbohydrate consumption is low, and we are supplementing with some nuts, ground nuts or peanuts like this. That will supply some good fat, so our good cholesterol will go up. That is also very much healthy for us. And some of the agents, though they are claimed to be good, suppose green tea, that
Hmm.
contains the polyphenols. They are also very good for our heart health, but they have got a bad impact on kidney also. So we cannot liberally advise that you should take green tea randomly daily. It can be taken in limited amount, suppose once a day or
Yeah.
5 times a week. Suppose the like that. Not that we should take green tea too much. And another is this garlic that contain also some and chemical agent, the olesin, that is also good for our heart health. But this garlic should be fresh. It should
Hmm.
not be burnt or anything. That is, should not be modified. But another problem is that this garlic has got a strong irritation on stomach. If you go on taking in empty stomach, some people may not tolerate it. They should be warned that if you have any stomach ache, you should stop it. So with precaution, we can take all these. Another thing is that we can take some fresh fruits also, fresh fruits, and also fish. Fish is a good source for some monounsaturated fatty acids. They are very anti-atherogenic. They are highly protective to our cells, and but that fish to be taken not in a deep fried state. Deep frying will, mane, this monounsaturated fatty acid will be lost. So if we want to take this good thing along with our fish, so that we can get protein plus this antioxidant and this monounsaturated fatty acid, we should take in a baked state or boiled state. Deep frying will create loss of these good agents. Like our
Thank you.
vegetable cooking methods should be
Yes.
changed, that we should not go for frying.
Thanks a lot, sir. You gave us a really good, food. You actually have suggested what to eat and what not to eat, which and the limits, how much of limit of consumption is good, and how much of it will actually affect your heart health or your stomach health. Thank you so much for explaining that in such a simple way and elaboratively, as this is actually what we want, because people are not aware what they'll eat and what what impact it can cause on their health. So thanks a lot for that. So another question, when we're talking about our eating habits and the food that impact effects on our health, there's another some myth, or I can say misconception, that you can clear that out. If people say that two small drinks of alcohol or a particular amount of alcohol is good for heart health, So is it true or bad or false?
Actually, if you go into deep science, that is, there's alcohol has got limited amount of alcohol has got some good effect, and in that way that it can increase your good HDL cholesterol. But thing is that alcohol is very much addicting. If you allow someone that you can take alcohol, suppose 30 ml or 60 ml in a day for 3 days or 4 days in a week, just after a few months, it may get changed to a binge drinking of 150 ml or 200 ml 3 or 4 times a week. So that's
Yes.
why if you go on advising alcohol you can take, I think that is not acceptable in all ways, because this addicting nature of alcohol will drag that people to have more drink. If they can restrict that, that is good. That's why in a general advice, we cardiologists usually say, no, 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 limit it, limit it like this. Social drinking is allowed, but if you go on taking it daily, that will be dangerous for you.
Thanks
And
a lot for
another thing,
clearing that.
another thing, what we are talking about these habits, all
Yes.
these habits, also smoking to be when 100% to be avoided. And
Yes.
at birth, we are non-smoker, 100% non-smoker. I mean, all people when they are born, when they are non-smoker, they become smoker between 11 to 21 years of age. Most of the smokers start smoking between 11 to 21 years. Now, the thing is that if you want to implement this diet habit, not to take alcohol and not to smoke, that to be implemented in the teenage, because most of the smoker by the age of 2021 or in our age, they will be a bad smoker now. It is very difficult to quit smoking or change our dietary habit, because dietary habits build up before 12 years of age. And if you want, advise someone that you should go for exercise daily or 5 times a week for at least 90 minutes in a day, and practice yoga for at least 30 minutes at least, that at the end of the day, it is very difficult to implement in daily life. That means adherence to these advices are very low in adult age. If you want to implement, that to be implemented in the teenage when they are developing. Otherwise, chance of adherence will be very much low. Hardly 11 to 12% will implement, and most of the people will not follow our advices. That means during childhood, it should be implemented. That means the task is going from doctor to parents. That means it should not be done on doctor's advice. It should be done by parents. During childhood, they should practice or they should cook such a way their food for their children that should not contain too much of oil, that should not contain too much of refined carbohydrate, and they should not deep fry it. Once the taking of deep fry food is habituated by a fellow, it is very difficult to quit and change their habit. Those who have not taken good fruits in their childhood, they will not prefer it in their adulthood also. That's why any kind of dietary change is the task of mother. Any kind of exercise you are going to implement, that to be implemented by 18 years of age. Suppose a man of 30 now having a heart attack, I am advising for a regular exercise and go for regular walking or, you know, any kind of cardio exercise. His low back will not may not support, or his knee or ankle will not support, because he may feel after 2 3 days of exercise bad pain and he will quit it. So the
Yes.
task is going back again to at the age of suppose 9 to 19 teenage. So those who are not accustomed in their childhood about their exercise, they cannot do it in the adulthood also. That means all the diet, all the bad habit, all the exercising capability that develops in growing age. That means all these preventive measures should go back to our childhood and during our puberty. That is the age where we should implement everything. That means what we are talking now, it should be seen mostly when to be followed by the younger ones, rather than those who are now already become patients or grown older.
Thank you, sir. So, thank you so much, Dr. Mandal, for explaining that. And you said it right. It all comes under our dietary choices, the kind of food we are eating, and the kind of lifestyle we are living. And it's all our choices around, because we all have healthy choices and unhealthy choice to live. But it depends upon us what we pick, and that affects our health. Maybe we do not understand at an early age, but later on, when people suffer from any kind of disease, I think then they regret their choices. They remember what else could be done in a better way, so that now they would not have landed here in that situation. And I think that's why we are doing this kind of podcast, to raise awareness as much as we can. So, lastly, I would like to have a short small message to share with us listeners regarding heart health.
First of all, I'll what we have not discussed is I will trace on that first. That is, we have a diurnal cycle of life, daily life. Suppose 24 hours life cycle, that is a diurnal life cycle, what we are practicing daily, that to be followed. That means we have a fixed waking time. And for Indians, for this area of this globe, that means our Indian zone, time zone, it should be between 5:30 to 6:30. That is the best time of waking from bed, and that to be maintained. And going to sleep, that is also should be between 10:30 to 11:30. That is the best time. We should give attention to this area, because this sleep wake cycle has got a strong effect on our health also. If those who are sleep deprived, they have a higher chance of cardiac disease, they have a higher chance of metabolic disturbances, they have a higher chance of diabetic development. That means they become more diabetic in future. So this sleep wake cycle has got a strong effect, and we should take care of our daily diet. It should contain less fat, particularly burned fat, should contain less carbohydrate. It should be more rich in vegetables, colored vegetables, naturally colored vegetables, and it should be mostly boiled, not fried. Not fried. We should avoid 100% avoid smoking or other form of tobacco like khoini, dokta, gutkha, jorda, like this. And we should moderate our alcohol intake. Preferably no. Though someone may question that why you are telling that, because it is addicting. That's why you should
Yes.
tell that better to avoid alcohol also. Those who have not taken alcohol in their life, they should not take it. Just for it is a myth that it will protect their heart, they should not take it. And do exercise daily, preferably at least 90 minutes in a day, 90 minutes in a day for younger people. And for older, it should be at least 60 minutes in a day, 5 days in a week. And should practice yoga at least for 30 minutes, 20 to 30 minutes, preferably at the end of the day. That will give a mental calmness, and also there will be good sleep. If I, after going back and sitting for a puja or doing some yoga for 20 minutes or 30 minutes, whole day's train will be taken care of. Whole what stress we have gone throughout the day, that can be abated, and my sleep will be good. And at the end of the day, we should take care of ourselves regarding stress also. We should not drag our job to home, and should not spend on too much time on screen. That means that may be a LED TV, or it may be a smartphone. We should not give too much time on that. That is also creating problem in our modern age. So with that, that means from waking up to going bed, we should keep something in our mind like this: waking time, food, exercise, sleeping time. And we should avoid what things, that means we should avoid smoking, alcohol, and also screens. That means LED screen. That is the message to everyone, and we should follow this. It is applicable to me also, to my family members, and all feelings should be there to our neighborhood, and that to be spread to everyone.
You said it right, sir, and you have given us all the tick marks, what should be done and what should not be done. So thank you so much for explaining us to us and to all our audience. Thanks a lot for sharing your insights and expertise with us, because to create this awareness, your experience, expertise, your words, and your time matters a lot for coming to this platform and sharing your words with us. Thanks a lot
Thank
for
you.
all the
Thank you.
contributions.
Thank you.
Thank you.